Well, I said before that, when we feel shame, it's a really horrible, really yucky, it's a technical term, yucky experience. And and therefore we don't want to go anywhere near it. Yeah. But actually, from an emotion focused perspective, what we need to do if you want to get out of that shame or to heal that shame, is to go towards the emotion, to really feel and experience that shame and experience it profoundly, so profoundly that it becomes obvious to us what we need.
Dr. Lou Cooper is a counseling psychologist and lead trainer and presenter at the Australian Institute for Emotion-Focused Therapy. Lou is accredited as a therapist, supervisor, and trainer by the International Society for Emotion-Focused Therapy and teaches and presents regularly in Australia and internationally. Lou is also the host of the Emotion Focus podcast and appears regularly on radio in Australia talking about emotions. Lou, the one emotion we want to talk about today is the one I guess so many people know and almost everybody knows, the sense of worthlessness. And I think that's the one feeling especially all my clients have in common. And I know that there are several factors that contribute to a feeling of being worthless. But can you briefly explain to us why so many people struggle with feeling worthy and enough?
It's awful, isn't it? When you say that, when you describe that there are so many people that do feel worthless or not good enough. And I'd suggest, I know I get that sometimes, I'm sure you do too,
Absolutely.
that, that feeling of just not being enough. But why so many people struggle with this, I think there's a couple of ways of looking at it. One is that at some point, most people have learned this. We're not born thinking we're worthless. We're just not. We're born to survive. And somewhere in our, quite early on in life, often we learn that we're not important or we don't matter. Yeah, in some
Right.
way.
Mm-hmm.
I think why so many people struggle with it as adults is that the experience of feeling worthless is really painful. It's shame. I'm not good enough. It's shame. And we just want to disappear. We just want to become invisible in that because it's so painful. And therefore, because it's so painful, we do all sorts of things to try and get away from that pain. So sometimes we don't even realize that that's what we're experiencing. And therefore, we're not able to get out of it. So I
Absolutely.
think, yeah, it's a lack of understanding of actually what's going on that means
Yeah.
that we just stay in it.
So can you help us then? Which are specific childhood experiences that cause a sense of worthlessness and inadequacy?
Well, I think this is another thing. When we're feeling bad, in whatever way that might be, if we're feeling shame, we like to be able to find the cause. We like to be able to say, I feel like this because of that. And so there's a sense that, for instance, of course, if someone has had an experience of childhood abuse of some form, of course there's going to be a sense of shame as an adult. We can understand that. But it's not just an experience like that. I would say most adults as children at some point have that experience of not feeling important and not getting validated for who they are, not seen, not listened to. And it's nobody's fault. So someone can have a sense that they had a really great childhood,
Hmm.
but in that childhood, just because of the circumstances, the context, the environment they grew up in, parents or parent or caregiver is just really busy trying to earn money, trying to look after other people. And so sometimes it's the little people that seem to be okay and getting on with themselves, that don't get what they need. So, an example, for instance, I work with a lot of people, and I find this very interesting, a lot of people who have grown up with a sibling who is unwell. or has a disability. And therefore, that child in the family needs extra attention.
Yeah.
And the child that doesn't have the disability or is not unwell kind of has to get on with it and does get on with it, right? Does get on with it,
Yeah.
except they're left with a sense of not getting their needs met. That's just one
Am I
example.
enough then, right? Why am I not seen? Absolutely.
Yeah.
Yeah. And you said something very important, the sense of so many clients say, like, I had a great childhood. My parents did their best. How come
Yeah.
that, I still feel ashamed or worthless or unlovable? I mean, there are so many difficult feelings connected to shame, right? A sense of being also
Yeah.
unlovable, and that child that is not seen because the parents are stressed, right, with for whatever
Yeah.
reasons, and another sick child, or financially, or in the relationship. And these are situations that we all know very well, right? And
Yeah.
so from an EFT perspective, what are the major steps towards feeling enough and worthy?
Well, I said before that, when we feel shame, it's a really horrible, really yucky, it's a technical term, yucky experience. And therefore we don't want to go anywhere near it. Yeah. But actually, from an emotion focus perspective, what we need to do if you want to get out of that shame or to heal that shame, is to go towards the emotion, to really feel and experience that shame and experience it profoundly, so profoundly that it becomes obvious to us what we need. Well, I said before that, when we feel shame, it's a really horrible, really yucky, it's a technical term, yucky experience. And therefore we don't want to go anywhere near it. Yeah. But actually, from an emotion focus perspective, what we need to do if you want to get out of that shame or to heal that shame, is to go towards the emotion, to really feel and experience that shame and experience it profoundly, so profoundly that it becomes obvious to us what we need. Hey, for you as a child, it's not blaming anyone in particular, but it's just recognizing that for that child who was not able to say, hey, what about me? There
Yeah.
needs to be, in order to heal that shame, there needs to be some expression of that anger that was unexpressed. Yeah. And
And
also access the compassion. Yeah.
absolutely.
Compassion for that small child that actually needed to be validated, needed to be seen, instead of giving them an experience of shame.
And it's a complex process, because
It's a very
I
complex
don't know about
process.
you, but many people experience as like, why do I have to feel this awful feeling of shame, right? Because as you
Yeah.
said, you try to avoid it for so many years and found many beautiful coping strategies not to feel it. And so
Yeah.
how do you help people to stay with that?
Well, it would be nice to be able to do it. I mean, this is one of the reasons why people struggle with shame, because, I've just said, oh, well, this is what you could do. You try and do that by yourself, and it's going to be really hard, because it's like, oh, I'm not doing that. Where's the bottle of scotch? Or where's the distraction that I can engage with so that I don't feel that, right? So, I mean, of course, I'm going to say this because I'm a therapist. I'm going to say you actually need a therapist, or you need someone who has some understanding of this, who's able to hold you
Yes.
in that shame, and also notice when you do things to try and get away from it. So, a lot of people will try and rationalize what's going on for themselves. They go into their head. And we're generally all very good at that. If we've completed education, particularly, we've learned how to use this pretty well. But it doesn't work in this instance.
So
It
you say
doesn't stop us from going there to try and solve it.
yeah, having a safe space to experience it fully, right? Not only talking about it and not only understanding it. And that hits it, because so many people come to me and they've done so many different kind of therapies, right? And they talk to it, I know about it, I know I feel like, but I still feel the shame and I still feel worthless and not enough. And so it needs a safe space to be with it. And then you said, it's important to access some of the suppressed anger. And you had this beautiful image of the child, right? I always like to say, giving that child a voice to stand up for it, right? But that's also not easy.
Yeah, it's not easy.
Yeah, not easy at all, because that child learned, well, I'm already not seen and heard, so why would I get angry, or how am I going to do this? But can you help people to understand why the anger is so crucial and so important for the healing?
Why the anger is so crucial is because it's been unexpressed, and it kind of the child hasn't been able to assert themselves, right? The child hasn't been able to assert themselves, and if you can't assert yourself, in a way, what you're doing is you're activating the shame again, right? I'm not good enough to be able to do this. It's really important to give a person that's experienced shame not necessarily the tools, but the validation for their expression of anger. This isn't okay. It's not okay. Sometimes that anger sits there and is expressed in a form of rage, right?
Yeah.
Rage in response to the fact that you feel the shame, because it's better to feel angry. Angry is quite a sort of active emotion, and that can feel better than feeling the shame that sits underneath. So often, we call it a secondary reactive emotion. We'll feel angry at the fact that we have this shame sitting there that we don't know what to do with, and we can't budge, we can't move it. So, but that's not the anger that we're trying to activate. We want to try and activate what we call a primary anger, the anger that was never expressed by the child towards the parent for not meeting their need.
And this is very important, because you just explained different kind of anger. It's not the reactive anger of rage, but somehow a healthy response to an unmet need, a healthy sense of anger. And many clients ask me then, how do you notice when your anger is healthy? Do you have an example?
How do you notice if your anger is healthy? Well, if your anger is healthy, I can remember an example with one of my children once, where they did something. I can't even remember what it was now, but I remember very clearly. It was when I was a baby emotion-focused therapist trainee. And I used to be really awful with anger. I couldn't access my anger. I still find it very difficult. But I can remember they did something that was not okay, right? And I asserted myself, and I felt it surge in my body. And I said, that is not okay. You need to go and pick that up, or whatever it was, right? So the anger came up, and then I did what I needed to do, which was assert myself, express my anger, and then the anger just disappeared, right?
Yeah.
That's healthy anger. That's me asserting myself, which is very different from an anger that you feel rise up, and it rises and it rises, and an hour later it's still there and you can't get rid of it. Yeah. And maybe the next day and the day after, you're still feeling angry. That's not healthy.
Yeah.
Yeah. That's not healthy.
And also, I love this idea, because I have a little one at home as well who loves to cross my boundaries in many, many ways. That it's also connected, healthy anger, primary anger is also connected to the expression of a need, that you have a need in that moment, right?
Yeah.
And
yeah.
Okay. And then you also said compassion, self-compassion for that child, right? And how do you help clients to get there?
How do you help the clients get there? You send them to one of Shari Geller's courses, right?
Yes, absolutely. Yes.
Shari, yeah, who is the self-compassion person in the emotion focus world.
Yes, I
Um,
also had an interview with Sherry on compassion with grieving. And, compassion is the one primary emotion that is the antidote to so many other maladaptive secondary emotions, right? And
yes.
yeah, yeah. But so many people haven't had the experience of compassion from another. So they really struggle with somehow feeling compassion for themselves. And especially when you feel ashamed, you ask yourself, it's self-compassion might be pity or, self-indulging.
Yes. So, I mean, if someone has had the experience once, even if it was only once, and they can think of the person in their life that is able to express compassion towards them, to, if you want, take the role of that person and to express that compassion towards the self. And then kind of, I mean, when we do this in therapy, we use chairs to do this. And then, take the role of the receiver of that compassion. And in this process, trying to help, doing this repeatedly, to internalize an automatic expression of self-compassion when it is needed. Of course, some people will say, as you said, that they've never experienced that, in which case maybe there needs to be kind of an imaginary, what would it be like? Who do you imagine, who do you wish had been in your life that would have been able to help you out here? And kind of, if you want role playing that, even though it wasn't a real person, to be able to use that to give yourself the experience of receiving self-compassion, hopefully so that, that experience of receiving it becomes an internalized, and as I said, it's a kind of automatic thing that happens for you when you need it. Yeah. So instead of shame, or when there's a little bit of shame creeps in, you're able to almost automatically feel compassion for yourself rather than sinking into that space of, oh, horrible, horrible shame.
Yeah,
Yeah.
absolutely. So what are the biggest challenges in the journey of healing?
I think the challenge is uh, to be able to I think that is the biggest challenge, to be able to be compassionate towards yourself, compassionate towards yourself in your own vulnerability. Yeah. To allow yourself to, can I say this, just to feel shit sometimes,
Absolutely. Yeah, I
you
can
know,
agree with that.
yeah, and not go to a place of shame when we feel that, because often we feel shame about the fact that we feel shame. And we need to be able to notice, become familiar with our own process in this. What do I do to myself? How do I put myself there? How do I put myself in that place? And what do I do to myself when I am there?
Mhm.
Right? To be able to understand how we treat ourselves, and to be open to maybe be open about that, and forming a relationship, a trusting relationship with another person or with a therapist, to be able to seek the support we need to be able to stay in those nasty places, yeah, emotionally,
Mhm.
to be able to process them and change them.
Yeah, and also really feeling the compassion, right?
Mm.
That's, I think, the biggest challenge, as you just described, to really feel it and feel like, in your bones and your cells that you also deserve that you,
Yeah,
yeah.
yeah. And when we talk about self-compassion, it's often this, right?
Mhm.
And even just giving ourselves that,
Mhm.
it helps us pause. It helps us kind of connect with what is happening in our bodies emotionally. Because, it's an embodied experience we're talking about here. We need to work with our bodies in order to connect with it.
Absolutely. Yes. And so, what's the most valuable advice you can give someone working on their self-worth?
Be patient.
Mm-hmm.
Don't try and fix it.
That's a tough one, right?
It's a tough one.
Yes, yes. Can you say a little bit more about that? What do you mean with that?
Don't try and fix it, because whenever we move into fix it mode, we bring this in.
Uh-huh.
And when we bring this in, often we're taking ourselves away from actually what the feeling is. To allow ourselves to feel pain is really challenging. Once people have felt pain, emotional pain, and know that they've survived it, they're going to be more willing to go there again. But to do that for the first time, even with someone supporting you, it's really frightening, can be really frightening. And that fear can stop us from doing it.
Absolutely.
So,
Mm-hmm. And it's not
yeah,
happening within 2 sessions, 3 sessions of help, or it's a longer journey. And the patience part is, I think, extremely important, because so many people feel then hopeless at some point, wondering if they can ever, change shame into compassion, or have that compassion for themselves, or express their anger. And
yeah.
yeah.
So, I mean, it's taken a long time, actually, maybe not so long, for the pattern to have developed where shame gets kind of activated really quickly. It's taken some time for that to happen, and then it's been reinforced and reinforced and reinforced. So it can, maybe someone in their 30s or 40s or 50s or even older may decide to, I actually want to do something. I don't want to feel like this anymore. And it's we're undoing things. And I think the courage that we need, or our clients need, to say, actually, I'm going to try this, and then be told this is going to take some time. This may be painful, but to still have the courage to say, I want to do this. I
Yeah.
want to do this. And to have the trust and the faith, if you want, that it is possible, is really challenging.
Beautifully saying, emotion focused therapy is the only way out is through.
The
And
only way out is
yeah,
through.
yeah.
Do you know that book, Going on a Bear Hunt?
No, I don't know that one.
I don't know where that book comes. Certainly have it in Australia. I don't know where it was written, but it's um, going on a bear hunt, right? Trying to find this bear. And there's a sort of repetitive, it's a children's book. There's a repetitive line which says, when they hit the cornfield, you can't go over it, you can't go under it, you have to go through it.
Yeah.
And that's kind of how it is with working with our emotions. You can't go over it or under it. You just have to go all straight through it. Yeah.
Absolutely. Yes. Thank you for this inspiring, beautiful interview and this beautiful image. I'm going to go and buy the book for my daughter and see if I can find it somewhere. And happy holidays. And I wish you a
Thank you. And to you.
healthy end of the year.
Yeah. And anyone who's working with their shame, just hang on in there.
Absolutely. That's, I think, the most beautiful advice. Thank you, Lou. Hope you enjoyed watching the interview with Dr. Lou Cooper. As you heard Lou saying, be patient with yourself. This is a process. Happy holidays, and see you at my next interview.